Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. Again, hello. We just want to give some reminders that there are only 87 days left until the 2020 presidential election on November 3rd. Please make your voice heard and vote. If you need inspiration, watch the Lunch and Learn that aired last week featuring the legendary civil rights activist, Miss Carlotta Lanier of the Little Rock Nine. If this is your first time joining us, thank you for tuning in. And if you're already familiar with our weekly series, we encourage you to spread the word and let other members of the community know about our live stream. In fact, someone sent me the link for today's Facebook Live, and I was, one, surprised, two, elated, and then third, I was just like, if you see my picture on it, don't you think I already have it? But you know, that's good looking out from our community. Now, we're just waiting for a few more minutes for people to tune in, and then we'll get started. And as we wait, I'd like to introduce myself and tell you a little bit about the Center for African American Health. I'm Yolanda Gotier, the Senior Living Health and Wellness Navigator. And essentially what that means, if you are a resounding golden 50 and older, and you need information, want to take some free courses, I am the person you contact. We've got a new series, Journey to Wellness, coming up on September the 8th. So check out our website for more information. For those of you who might be unfamiliar with the work of the Center for African American Health, we have been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. We are community-based, evidence-based, disease prevention, and disease management program events and services. You can learn more about our work, and as I said, some of our upcoming programs by visiting the website at CAAHealth.org. As we move through today's session, please feel free to type any questions that you may have in our chat box, and we will address them if time permits. Let's see. Today we're going to be discussing the challenges families are faced with this year as students head back to school. We know this has been a hot button for many, many parents, and we want you to know that while we don't have the answers, we definitely have many suggestions and opportunities for you to ask questions of our guests. We'll share tips and strategies that you can utilize as you navigate this unprecedented time and ways to manage the anxiety surrounding the abrupt changes to schedules and routines. Our guest this afternoon is Rossina Schroeer-Santiago. She is the founder of Element of Discovery, Therapist of Color Collaborative. Rossina has a master's degree in she has a master's degree in clinical mental health counseling. That's what happens when you try to get ahead of yourself, and is a licensed professional counselor. She holds a certified counselor endorsement and is also a global career facilitator. Her private practice, the Element of Discovery, Therapist of Color, was founded to serve individuals of color with therapeutic services that are culturally responsive, culturally sensitive, and trauma-informed, and delivered with compassion to advance racial equity in the mental health setting. You can learn more about this collaborative by visiting elementofdiscovery.com. So with that, I want to say welcome, Rossina.
Thank you so much for having me today, Yolanda. It's truly a pleasure to be here.
Good. So let's wait like a minute and then we'll just jump right in with questions.
Perfect.
Okay, now I know that probably wasn't a true minute, but in terms of airtime, it was like thousands of minutes. So, Rosina, I think it's safe to say that there's always been a healthy amount of stress in households with students who are preparing to return to school after summer break. But this year, our worries appear to be through the
Absolutely.
roof. So, just last week, Denver Public Schools announced the start of the school year will be complete. It's going to be online through mid-October due to the coronavirus pandemic. And the Colorado High School Activities Association announced on Tuesday that many traditional fall sports, such as football, gymnastics, and soccer, are unable to be played under the current state health guidelines. We've also seen on Facebook, on the news, on Twitter, those schools that opened in Georgia, and I'm sure many of us have seen that halls setting where children seem to be neck and neck, shoulder to shoulder, with only two people in the picture wearing masks. So with that, I mean, I think not only what's happening for us locally, but nationwide, I think it raises our questions. So can you talk about the pandemic-induced trauma and stress that's surrounding all of these changes?
Absolutely. I think right now, with just this concern of having, COVID-19 around and this, this return to, I think, what people are still trying to figure out, from our legislators to schools to just in our own homes. We're worrying about a lot of things. We're worrying about our health. We're worrying about the health of our loved, worrying about financial situations. We're worrying about potential losses of support that some people could be relying on. And so, like, with all of this, it's creating disruptions in just like how we're sleeping and even how we're eating. It's probably creating difficulties with concentration. People who already have problems with their health and concerns about their health could be experiencing worsening of those symptoms of the health conditions. And then when I look at, mental health and just where we are with that, people are even experiencing like a heightening of those symptoms, right? And just finding themselves sometimes without an ability to deal with that. And so when we think about that and we just kind of have all of those things on the plate, like, it's really important to like know what are some of the symptoms, right, of COVID-19, and be really in the know. There's lots of information and guidelines out that tell us like what are some of the basic symptomology, right, to give us some of that. Know where, when, and how to get treatment when you need it, right? Not just for your physical health, but also your mental health. A lot of mental health providers, including like my collaborative, we're doing telemental health services. Medical providers are offering telemedical health. And so there's lots of different ways to get help and knowing how to access that. And also being able to, when I think of just kind of detoxifying a little bit, also knowing when to take breaks from watching and listening to some of this stuff that's happening, because, the information that's coming in, be it just around different world events, the information about COVID, having to return back to school, the loss of different things, it's taking a toll on us having to just constantly be bombarded with all of this information. So knowing how to take healthy breaks from some of that stuff is really, really important. Avoiding this excessive, contact with, this toxic media are all things that people can kind of begin to do. Mindfulness is really, really important. Knowing how to just sit and take some really deep breaths and just, cleared, quiet concentration to just be one with yourself in the moment, and trying to do so without judgment, which I know is really hard for a lot of people. But just kind of taking that break to say, I need to sit with me. I need to sit with my thoughts, even if it's just for 2 to 5 minutes, and just to breathe. And so, yeah, it's a lot for a lot of people. And we don't often prioritize these things that are all tied together when we're in the midst of just trying to survive, right? Just trying to make it by, as well as trying to figure out what the new normal is going to be as we are getting ready to head into this school year.
Okay, thank you for that. We know that some parents are trying to balance working from home in addition to creating a suitable environment for their children to not only live, but also to learn. Can you offer some tips on creating space and boundaries so that everyone can accomplish what needs to be
Absolutely.
done?
When it comes to like looking at this, what this home learning and still trying to work from home and all this looks like, I think it's really important for parents to try to make a schedule of your time and be able to manage where you're putting your focus and at what point you're putting your focus on that. So that way you can kind of try to create a routine. A lot of people, which, and I think of, from military to academic settings, right? They all have one thing, which is a routine and a set schedule. And the more of a schedule that you can create, the more of an ability that a parent can manage what's happening in their household without being bombarded, right? Having a schedule, I think, also lifts that burden of trying to juggle the multiple tasks that we have, which generate those feelings of overwhelm. And it's allowing you to focus on smaller, manageable things, right? It doesn't have to be for the 50 minutes or an hour that might be happening in school. Maybe we're just being able to focus on 20-minute mini lessons, right? And we're doing those 20 minutes and we're focused and we're dedicated to just for that moment and that time, focusing on whatever it is. But the more that we can create a schedule and carve those out, the better it's going to be. In therapy, we talk a little bit about SMART goals when it comes to how you create a pattern and what SMART goals are. And I like to say SMARTs, and I put an S at the end of it because it stands for being specific with what it is that you want to do. So setting a goal, being able to measure that goal. What are some things that you're using and deploying to be able to attain that goal? What resources are you tapping into to be able to move towards that goal? And how, at specific increments, how are you checking in on that? And so the T is for time bound, making sure that you're sticking with those specific time increments to check in and being so if we're doing a weekly goal, maybe on Monday, we're setting it and we're looking at it. And then Wednesday, we're seeing how it worked out again. And then Friday, we're doing kind of an after action review and we're saying, well, how did that work out for us this week? And if it didn't, then it gives you an opportunity to make some adjustments and refine your SMART goal for going into the next week. The S that I like to end at that is support. Support is super, super important. Like the way that we get through, get by, and get into things is by leaning on others. It's so important, especially in a time such as now, to connect with others, talking to people you trust, connecting with folks in the community who are trying to do the very same thing. Even faith-based organizations are doing things. Boys and girls clubs are trying to do things for, us as families and for the ability to take care of our kids. And so being able to connect very deeply with community and others who are trying to do the same thing and be creative. So that way we don't have to feel so burdened by having to try to create something for ourselves. I know in my family, we've kind of created a co-working family space here at my home. And, it's two of my cousins and our kids. And right now, while I'm in here, they're downstairs with my little ones and my teenager, and they're kind of just playing and taken care of. And then when school starts, we're going to be trying to offset who's doing what in the midst of us trying to work too, because it is a real thing where we're having to manage multiple responsibilities in the context of just one environment, which is our home.
Mhm. Well, that speaks to an even larger issue in that a lot of people don't have a lot of space in their
Right.
home. And, so what may appear to be my mansion today, for me, may not be that mansion for someone else.
Absolutely.
And when space is tight, how can our families adapt
Yeah.
when so much of our time right now is being spent at home? How do we adapt? I'm What if I am a single dad in a 2-bedroom apartment, and I'm the dad, I sleep on the couch because two of my kids are in each one of the bedrooms. How do I work that out?
Absolutely. You know, more than anything, Yolanda, I think even in the tightest of spaces, like no matter what, it's so important for everyone to have a dedicated space to do their dedicated tasks. You know, if it's, you know, from writing to being a creator, you know, if, you know, somebody needs art, or if somebody's doing, you know, whatever task it is, we all need our dedicated spaces to do it. And in mind, what I found, I love and lean on Pinterest a lot. Pinterest has wonderful ideas for tiny spaces. You know, I've seen closets, like little wall closets that coats are just hung in, created into like mini workspaces on Pinterest. And so when you're trying to maximize your space, it's so important to get creative. But it's also very important to ensure that you have that dedicated space to do that, because, you know, I think of, you know, for like sleep hygiene, if you are working in your room and you don't have, like, your body doesn't get the cue from looking around its environment that this is a place to sleep because you've had to make it into a workspace, it is going to disrupt your ability to be able to sleep, because your body is feeling all of the external cues and it's recognizing it as a place to work. So when we have a dedicated space, be it something that can be folded up and put away, you know, whatever, your body can orient itself into that time and space. So if it's time for work, it knows this is a space for work. For our kids, for school, if they have a dedicated space, which they know it's time for them to do their work, they go, they open up, they sit at the kitchen table, right? Or they sit at that dining room table, wherever it is that we're making this dedicated space. And we're saying, this is our space where we come to work. This is our space where we come to put our brains in a space where we're learning, and we're trying to make it as aesthetic, right, as we can. But you know, use what you have. You don't have to do it on a whole baller's budget. You could do it on a penny's budget, right? And that's why I love Pinterest. It has lots of low to no cost ideas that really help people create and carve out spaces, maximize tiny spaces, but also be able to make them productive spaces. And I think that's really important when we're looking at what we're faced with.
Well, thank you, because that's a great reminder to those of us who are working from home to not make our bed our new desk.
Yes.
And so with that, we also know that there are parents who are making some very tough decisions when it comes to their children, their overall health, and the safety of their family. What words, again, of advice can you offer to parents experiencing perhaps guilt if they aren't able to work from
Absolutely.
home?
I think parents just, you know, it's more important to recognize that they are making the best decision they can under the circumstances that they are being given, right? We are all making very tough choices all the way around. And if a parent is putting themselves in a space where they're being and beginning to feel guilt, then it's also going to the ability to show up as a parent when it's time for them to be in that space where they can be a parent without feeling bogged down, right? And so if they can just recognize that they're making the best decision they can under the circumstances, they're deploying as many precautions to keep themselves and their family safe in the way that they have the ability to, you know, it allows them to give them some grace under fire, right? And not feel that they're having to continue to burden themselves with, like, gosh, you should have did this or you should have did that. And, you know, if you would have done this, you know, no matter what, I think there's no guarantee that if we would make any other choices that anything would be any different than what it is right now. And so being able to have that grace under fire, that grace in the midst of any perceived shortcomings, it just gives parents the ability to just show up as much as they can in the moments that they have, and not worry so much about what's been lost and what conflicted with. Just be in the moment as much as they can to show up for their kids in the way that our kids need us to be there.
Thank you for that. We've got some questions from those who are listening in. And it certainly fits with this question of people of color often have difficulty seeking therapy. Do you think the pandemic has made it easier for our people to ask for help and then one get connected to mental health services through telehealth?
Absolutely. So there's two parts. I think with what this pandemic has done, right? I'll say, I won't necessarily say easier because that might, we're still working through a lot of things, I think, in our community. But what I will say is it definitely is creating an awareness to mental health being an issue and mental health being the thing that we've long been aware of, like our physical health, which is that exterior portion that we get to see. But now we're kind of recognizing the frame and the structure on the inside, which is our emotional and mental health, that is coming into focus. And so with this created awareness, I think it is giving some permission to folks to begin to ask for help, and they're having discussions with friends, family, and they're actually like reaching out. And so, my organization, the Therapist of Color Collaborative, is one entity, right? There's lots of different places around. And so if people are working, their employer sponsored benefits is a great way for them to check in and see who can I utilize for mental health benefits. If they're looking for affordable counseling, there are entities, there's my collaborative, there's Maria Drost, there's Aurora Mental Health, there's Mental Health Center of Denver that all offer, affordable counseling benefits. Some even do Medicaid sponsored benefits. And sometimes even touching bases with different community resources have access and resources for mental health, such as the Center for African American Health. I mean, you all definitely serve as a portal and a hub, for community to be able to get the information that they need. And so, it's so important for people to be able to reach outside of their homes and reach out into community, be able to find out some of the information that they may be needing or even just curious about.
Okay, one of the other questions is what happens if you're having issues with getting connected due to technology or internet
So some
access?
people, I know in my collaborative, as well as, just what telehealth in general has pushed us to, it has created a space for us to be a little bit more accessible in terms of if people cannot connect via the internet, we do have the ability to touch bases by a phone call, right? And to be able to make those resources available so that people can have calls, and get access to some of the help that they need. And then some services, of course, are still being done with abiding by safety protocols, can be accessed in person as well. So it's not completely right, that we're only solely relying on telehealth and telemedicine, but people are also able to still get, in-person services, as people need them.
Okay. Um, and the inevitable question, we all know somebody that we'd like to give some advice to.
Mhm.
How can you convince someone who is still uncomfortable with seeking therapy or engaging with a therapist to just try it?
Ah, yes, I love that question, and thank you for that. I like to say that, and I utilize this a lot in therapy. When I'm sitting with somebody, so with that self compassion, and I talk a lot in my work about self compassion. So, self compassion is that talk that you have with your best friend or that confidant, and you're having this exchange. These people are always going to want what's best for you, and they're always going to want to make sure that you are getting access to the things that are going to help you. And the other part, being that friend who's offering that advice, is also being able to say, like, what you're bringing right now is really heavy. And as much as I want to be the person who can give you this answer, I feel like there's somebody else who's more qualified who can be there for you. Can I help you find this person, or can I help create a point of access for you to get to these people, right? Because I think sometimes even in those exchanges, we don't say that we can't help, and we don't say what our limitations are. So it's being able to, one, say what our limitations are, being able to be a good support and facilitator to making that connection, especially when we know that people are having a little angst or, just nervousness about sharing with a provider. But that we're making sure that they get connected. So just making it okay, just normalizing and saying, it's okay to not be okay. And it's okay to talk and share with somebody because you need to. And I can't be the person that you need to do that with.
Well, thank you for that. And as we wrap up, because we're just and your colleagues at the collaborative are inundated with people requesting resources. Do you have a couple that you want to share, or should we look for them on the Facebook Live, as well as looking for them on our CAA Health website?
Yes, I recently just shared, and so I believe it's a paper resource that I got from a dear friend of mine, Janet Damon. She works in DPS as a library service specialist, and she is very much rooted and connected to providing culturally sensitive services and supports for all of our children and families within this umbrella. And so I have shared that document with CAA. And another resource that I found that's also chock full of info is coloradoparent.com. And that I believe that link is also being made available. And those are just a couple, right? They're not all exclusive. And I will work to continue to feed in some resources. But, there are plenty of resources out there. Schools have some. The Boys and Girls Club has been posting some new resources. PBS definitely has some at-home resources. And so, I'll try to get some additional links, but there's lots of information out there right now, especially at a time such as now.
All right, thank you for that. So for those of you who have joined us, we want to say thank you so very much. I especially want to say big shout out, big thanks, big hug, big COVID-19 hug to you, Rossina, for joining us today and being with us. The information you gave us is invaluable. And just want you all to know that this video will be available along with our other information that from other Facebook Lives on the center's website at caahealth.org. Join us next Friday when we will be discussing the widening inequities impacting Black and Brown students and families returning to school this fall. So again, thank you for joining us, and have a safe, wash your hands, wear your mask, wash your hands, wear your mask, stay 6 feet away, don't go to large parties, so that we can see you next week. Have a good weekend. Thank you.